Hello, my name's Diana Sunshine, and I'm on the Coursera team that works closely with our university partners to deliver degrees online to the world. Welcome to today's webinar entitled Impact the World with Public Health, Why You Should Go into Public Health. Before we get started, I would like everyone to get a little comfortable with the Zoom interface. If you hover your mouse over the navigation bar, you can see a chat button. Please click on that chat button and let us know where you're dialing in from today. Let's see what everyone starts doing. We have a couple hundred people on already. So people, can you start chatting in where you're going? Oh, here we go. Florida, DC, Italy, Los Angeles, Liverpool, Lebanon, Westchester. Wow, Egypt. This is awesome. I love this. So this is really exciting. So as we say, good morning, good afternoon, good evening to everyone here today. And so this webinar is aimed at online learners at the beginning of their journey to understand what type of degree they may be interested in. This webinar is for people who are new to public health and would like to understand what public health professionals do and how their work impacts our world. Some people on this call may be deciding between degrees in public health, public administration, business administration, or hospital administration. Today, we hope to provide you an overview of what someone can do with a public health degree. And I'm really excited because I have two people on the panel joining me today. I have Miguel Alvarez and Adara Citron. So Miguel, why don't you introduce yourself?
Hi, everyone. Thank you for joining in today. I am the head of enrollment at Coursera. So all of the questions that you may have around degrees and content that are related to the public health degrees, my team would be the one to be supporting you, and hope that during this session you have questions about how to be able to start learning in public health.
Adara, how about you introduce yourself?
Sure. So I'm Adara Citron. I'm a principal analyst with the California Health Benefits Review Program, and I'm excited to share a little bit about my journey into public health and what I currently do, and answer any questions you all may have about what it's like to get an MPH or my experience.
Excellent. So we're looking forward to covering this agenda today. We just wanted to let everyone know we started planning this webinar in January, knowing that public health is critical for our communities, both locally and globally. And as the weeks have gone by and all of us around the world grapple with the spread of the global coronavirus pandemic, now more than ever, it's critical to help build the next generation of public health leaders. So while this discussion today will not be on the pandemic, we hope that it can be helpful as you consider what it could look like to pursue a meaningful career in public health. So today we're going to spend about 20 to 30 minutes learning just more about public health. We're going to talk to Adara and see her professional path into her career. We're going to talk about what is public health, why it's important, and what careers you can pursue. And then we really want to spend most of the time in a Q&A conversation. So for your questions, it would be great if you could find the Q&A button on your navigation bar, so that then you can start putting your questions there. And then finally, we'll wrap up on how Coursera can be a resource for you if you're interested in learning more about public health in a course or in a degree program. So thank you for joining us today, and I'm looking forward to the discussion that we're going to have together. So we are so lucky to have Adara Citron joining us, and she is going to provide us a little bit about herself. So Adara, it'd be great to hear about your career path to public health today.
Yeah, thanks, Diana. So starting off, my journey to public health really began like a lot of people I talked to. We're interested in medicine because we want to help people, but we're really not aware of all of the different opportunities that are available to help a variety of people. So once I realized I didn't actually want to be a physician or a nurse, I found my way to a health education program at San Jose State University here in California. There I learned all about health education principles, program planning, harm reduction strategies, and all of the work that really goes on at the local level to help keep a community healthy. I really enjoyed this, but I was looking for something a little different for my career. So I decided to learn more about policy and advocacy and pursued a few internships where I analyzed legislation and helped support an advocacy organization's mission. I learned I loved looking at legislation objectively and trying to discern potential impacts. From this experience, I knew I wanted to go into health policy analysis. I was lucky enough to work at Kaiser Family Foundation on the Women's Health Policy team for 4 years, where I was able to hone my skills as a writer and an analyst. During this time, I also pursued my MPH from the George Washington University in Washington, D.C. And the skills I learned in graduate school really gave me the tools to think critically about various issues. I knew I wanted to pursue an MPH versus another type of advanced degree, such as a master's in public policy, because improving public health is really at my core mission. Diana, can you go to the next slide for me?
Of course.
So after graduate school, I worked at DC HealthLink on the small business team, where I assisted small businesses with purchasing health insurance. This insight into how a state or territory takes something passed at the federal level, in this case, the Affordable Care Act, and must implement a fully functioning program within just a few years was really eye-opening. Within the thousands and thousands of pages of legislation and regulation, there were still so many ambiguities and missing pieces. Not only was I able to learn about how a program is developed and implemented, I was also able to see the ways in which implementation is an ongoing process and requires many times multiple reinventions and redesigns. So I'm currently a principal policy analyst with the California Health Benefits Review Program. And here we analyze health insurance legislation for the state of California by working with multidisciplinary teams of faculty and researchers from many of the University of California campuses. We look specifically at the medical effectiveness of a proposed test, treatment, or service, the cost impacts, and the public health impacts. And when I say public health impacts here, I'm really talking about the impacts on the whole population instead of just at the individual level. My role in this is to conduct the policy analysis components, interface with external contacts such as health plans, state regulators, and bill sponsors, as well as provide project management and analytic guidance. This work is really similar to what a consultant may do, which we'll talk about a little later, because we become experts in a very specific area very quickly. Some of the bills we've analyzed in the past include requiring higher reimbursement of telehealth services, requiring coverage of infertility treatments, requiring coverage of blood-lead testing, and requiring coverage of services provided by various types of providers. And just to wrap up, I really love this job because I'm part of a team that is dedicated to providing legislators, advocates, and interested parties with factually accurate information as they're making these really important decisions that impact many people in California. And with that, I'll pass it back over to Diana. And as I said, I'm happy to answer any questions about my journey at the end of the presentation.
Adara, thank you so much. That's such a great story. So now what we're going to do is turn our attention to what is public health. So public health is a broad field that encompasses a variety of different fields that focuses on education. It prioritizes improving and protecting community well-being while centralizing, predicting, and preventing future health problems in a general population. Adara, what do you think of that description? Do you have anything that you would like to add?
I think this is a really good description of public health. One of the key aspects is the focus on thinking really beyond the individual level and examining why something is important for the greater good. And by doing this, you really lift everyone instead of just one person.
Yeah, and one of the things we found really interesting when we launched public health degrees on Coursera was that we've seen a number of nurses and physicians also be interested in taking our public health degree. We found that a little surprising. Does that surprise you, or do you have any insight into that?
It really doesn't surprise me. In public health, there are so many people with clinical degrees as well. And nurses and physicians have a really amazing insight into what does happen at the individual level. They also see how people behave in a typical manner, whereas in public health, we may only know what the ideal behavior looks like. And nurses and physicians are also often able to provide a different perspective than those of us who don't have clinical training are. And they also see firsthand the gaps in health education or health policy and can really help pinpoint strategies for improving public health.
That's exciting. Well, wonderful. So then on this slide, we're saying that, public health is important, and many public health issues that have been addressed have increased life expectancy by over 30 years. And I just think that is an amazing statistic. And given that we're in a global crisis right now with the coronavirus, we believe public health is now more important than ever. And for those of you considering public health, some things you might be able to consider is, one, you can truly make an impact at scale. Working in public health puts you in a place to help people in need and make a difference in their lives on large scale, whether it's increasing life expectancy or reducing infant mortality. You can work for a variety of organizations and institutions. Public health professionals are hired for their expertise at hospitals, universities, government agencies, non-government agencies, startups, consulting firms, and a variety of other places. And you can pursue public service, research, or advocacy. So those who work in public health can make a direct end-to-end impact, from researching a healthcare problem to directing policy and enabling a positive health outcomes for vulnerable individuals and groups. Is there anything you would like to add about that? Because you're kind of in the thick of it and you're seeing what's going on everywhere right now.
I think that's a really good description, Diana. I have a couple of thoughts, but I think I'll wait until the next slide to share them.
Perfect. Well, here we talk about just like what are all the different health issues that public health officials work on. One of the key points is that many of these issues do go unnoticed as they are being mitigated by public health officials. You can recognize that a number of these issues are those that are in the news and impact larger populations. So why don't you add some additional thoughts here?
Well, I want to say, the possibilities in public health are really endless. You mentioned being able to work in infant health, and that's, especially now, is a really, popular topic. There are also issues you can work on, such as tobacco and vaping cessation. And it's also interesting that within each area, just thinking about infant health, for example, there's so many different ways you can work on the issue. You can work at the individual level with educating mothers and clinicians about, new ways to provide appropriate care. You can work at the program planning level, maybe at the local or state level, or you can work at the federal level. It's just, there's so many different things you can do within each topic.
Awesome. So now we're going to look at how someone gets into the public health field. A master's in public health degree, or MPH, is a graduate level degree that prepares individuals to work with specific populations and communities to improve their health through awareness, education, policy, and research. An MPH program will provide students with a more advanced understanding of 5 core disciplines of public health. That's biostatistics, epidemiology, environmental health, health policy and administration, and social and behavioral sciences, and the potential for advanced knowledge in a given specialization. I saw someone in the chat said, I had an impression that epidemiology is also key for public health, and the answer to that is yes, that's absolutely true, and it is one of the 5 core disciplines. And many programs for getting a master's in public health do offer other areas of focus, such as maternal and child health, as well as global health. Adara, do you have anything you'd like to add to this slide at all?
No, I think that's a really good summary of a public health degree.
Excellent. So then there's a lot of skills that a public health profession needs to know, and I think, Adara, you can walk us through this kind of broad skill set that people are looking at.
Yeah, so the types of skills a public health professional needs to be successful include skills such as the ability to communicate complex information clearly and concisely, being able to analyze large amounts of information, thinking about how different pieces of the health system fit together. And one very important aspect of public health is really the ability to work with cultural humility. And this is the skill of being able to recognize differences between cultures, including your own, and do your best to not only acknowledge, but also create space for these differences and ensure, you're not suggesting a strategy that may not be appropriate within another culture.
Oh gosh, so there's a lot of different types of skills. Does someone need to have all of these skills to be successful in public health?
Absolutely not. Public health is a team sport. We oftentimes work in groups specifically so the team itself is well-rounded and has all of the knowledge and skills necessary to accomplish the goal.
Excellent. Well, wonderful. The growth in the healthcare industry provides a lot of opportunity for people who are interested in switching careers or for people who are interested in accelerating their careers. In the United States, the healthcare industry is about a fifth of the US GDP, gross domestic product, and the jobs in this sector are expected to grow 14%, and that means that we're going to be seeing 1.9 million jobs opening up by 2028. And then we did some internal Coursera research that shows investing in a public health degree will provide over a 10% return on investment. That means that if you invest $1, you would get 10 back later. And although this ROI, or return on investment, cannot be guaranteed, we believe getting an MPH is a sound investment for your future. Now, Adara, we're going to walk through some roles that you can get into after earning the MPH. I'll go to the next slide. Does that sound good? Or do you want to talk through this right here?
No, let's go to the next slide. That sounds great.
Okay. So a lot of the opportunity is in health policy. And so, Adara, you can walk us through all the different ways people can engage in health policy.
And just to note, I work in health policy, so this is where a lot of my knowledge is, but as Diana and I have been saying, there are so many opportunities. So, if you're not interested in health policy or you don't see something that aligns specifically with your skill set, definitely look around because there are just so many ways to be involved in public health, especially once you have an MPH. So starting with advocacy, advocacy is a really common task, not only for people in health policy, but just other people interested in public health. It's just really an opportunity for researchers and those who are interested in a specific topic to provide relevant information to policymakers at the county, state, and federal level. A lot of times legislators are working on a variety of things and they don't have the subject matter expertise to really know what is the appropriate path when they're crafting a piece of legislation or a program or deciding on funding priorities. So advocates really play an important role at every level of government. Policy research and policy analysis are really interchangeable. You can take advantage of these opportunities both at universities, at health policy think tanks, at other research organizations. We have two examples here. University of Michigan has a really great MPH program and they do a lot of health policy research. One thing they're doing now, which is really interesting, is they're really looking into the effectiveness of Medicaid work requirements and what those impacts are on people in Michigan. Rand Corporation is really involved in surveys, and they do a lot of public polling and a lot of other really interesting policy analysis. So there's a variety of organizations out there doing this type of work. Moving over to implementation, once we pass all of these laws at the local, state, or federal level, then someone needs to implement them and make sure they're working as intended. At the federal level, you have CMS, the Centers for Medicaid and Medicare Services, that really is in charge of a lot of implementation, and they have a huge workforce, not only in Washington, D.C., but really all around the country to make sure there's the necessary support for states to implement programs appropriately. And then consulting is another interesting area. Manat is here on the screen. They're really well known in the health policy world. Other organizations such as Avali or Deloitte have really strong health policy consulting arms as well. And this opportunity it can be really fascinating. You can work on a variety of different topics, learn a lot about so many things. And so there's a lot of good opportunities in the consulting world. And then lastly, just touching on some overarching themes in the health policy world. And I mentioned this a little bit in this slide where we talked about necessary skills, but really being able to convey complex topics clearly and concisely is a super important skill in the health policy world. And then identifying scientifically sound and relevant information is also really helpful. We know there's a lot of information floating around on the internet, and being able to identify what is based on fact and what is most useful at that time is a really good skill to have.
Wonderful. So now we're going to move to looking at what industries graduates from Masters in Public Health programs go into. And we see that most of them go to work in hospitals or pursue careers at universities and colleges. And many of these roles that they go into, they require the candidate to have an MPH to be considered. That's not true for every role, obviously, but there are many roles that once you start progressing in your career, that becomes kind of the next step, that to get to the next job, you need an MPH. And then lastly, there are some industries such as universities and colleges where when people have an advanced degree, that gets taken into account when they get their compensation looked at. So, so there are a number of reasons that getting the MPH can help you get into a career you're looking to. It could also help you accelerate your career, and then ultimately it can help you increase your earning potential. Adara, is there anything that you would like to add to this slide?
No, I think, yes, since I'm still talking. So, having an MPH is really a gateway into so much more, especially in the health policy world. Employers look for the MPH as a sign that you've completed a specific set of trainings and you have the skills necessary to do the type of thought work they're looking for. And I can just tell you from experience that without an MPH, I wouldn't be doing the work I'm doing now. You really do learn specific skills and how to think critically about various topics.
That's great. Well, that wraps us up for the presentation part. We are on schedule. I'm so excited to hear that. And so this is a chance for people to ask questions. And so we've been asking people to go into the Q&A to do your questions. And there are a few questions that have come up already. So the first question is to Adara, and it's from Kingsley. And he says, are there online public health jobs for international job seekers? If there is, can you point one in the right direction? I'm not sure I understand the question as much. Does it make sense to you?
So if I'm hearing the question, are there resources for people who live outside of the United States to work in public health? And what are those resources?
I think that's what he's asking for.
Okay. Yes, there are lots of opportunities to work in public health outside of the US. Global health, international health is a huge area. You don't specifically need to think about working at the global level. You can also look within your home country, and there should be lots of opportunities to work in public health wherever you're from. Thinking specifically about European countries, they have departments of health as well. There's always a lot of interesting public health programming and research going on in African countries. There's just opportunities all over. So even though all of us are based in the US, public health is definitely a global field. It just depends what level you want to work at. And that's really how you should focus your search about the different opportunities and resources available to you.
I think the other thing I would add to that is that there are there are multinational companies all around the world who want to employ a global workforce in emerging markets and in emerging areas where there are issues around public health. And so definitely thinking about how you can strategically think on being recruited for these companies, and having a degree in public health or relevant coursework and content is really important as well to set you up for success in your pathway of looking at international recruiting for many multinational companies all around the world.
Excellent. And so, Miguel, I think this next question is more aimed towards you. What should students consider when looking at a degree program that's online versus in person?
Definitely. I think a lot of factors here are going to depend on your personal time and commitment, right? So time and commitment, whether or not you can afford to take off time in the workforce to then go into to do an on-campus program, right? Most on-campus programs are considered full-time. There are some that are part-time, but you do have to balance that out with, if you're doing a part-time program with work, and some part-time programs require you to do some type of hybrid between online and on-campus lectures. If you are working full-time and you want to have the ability to be able to continue to be employed economically, it may make sense for you to do an online degree. And when looking at online degrees, you want to make sure it's from a global reputable university, a research university, top schools like the University of Michigan, Imperial College of London, those around the world that have a huge brand presence and are research one universities all around the world. That's really important as well. I think it does really depend on your personal situation, but if you are wanting to work and continue to have that income stream that's important, online is the way to go. I think if you also want to have the ability to access a global brand in the comfort of your own home country without having to think about immigration restrictions and having to think about having to come abroad, online is a way to go as well. And I think thinking about what during this time, thinking about on campus versus off campus online, you have the ability to do it in the comfort of your home and the safety of your home. And I think that that's something to consider as well as universities start to think about online programs and this whole global shift to online education.
Yeah, and I think one thing I would add to that is that the 2 degrees that are on Coursera that are 100% online do not state online on their diploma. So you can get it, but that and when you have it, it is the same degree as you would earn on campus.
Right. Also cost, right? Online programs might be less expensive in comparison to an on-campus as well.
Sure.
So that's a huge point there when considering your personal circumstance.
Exactly. There's a great question from Enrique here. He says, I'm 50 years old. Do you think I'm too old to start a public health degree, and more specific, a public health degree in analytics? Who wants to take that one?
I mean,
I can take that.
You can take that one. It's all you.
Absolutely not. Public health is a great field because people come from a variety of different backgrounds across the age spectrum, and it's never too late to learn something new. I think it's incredible that you're interested in, pivoting your career and learning a new skill. And I'm sure anyone would be lucky to hire you after you complete your MPH. That's wonderful.
Yeah, and I would like to add on to it that on Coursera, our degrees, most of our degree learners are older than the on-campus counterparts. Average age is 37 to 40 years old. It's never too late to learn, and we really believe in lifelong learning. Miguel, I know you want to add to this because this is a passion of yours that you've dedicated your entire career to.
Yeah, I think that in looking at education in general and having the ability to retool yourself and reskill, I think looking at this time and asking yourself, what do I want to be able to do? And what are the platforms and opportunities that I'm able to pursue that in? I think it doesn't matter what age, it doesn't matter, your income situation or your, any type of, things that you want to have in the future. I think it's never too late to have the opportunity to reskill and retool yourself, and being able to do that. And with a platform like Coursera, even if you are interested in a degree, you can look at open degree content. You can look at content that's related to public health, and being able to develop those skills is going to be important. And then having the ability to have that on a resume, to be able to pivot into a different type of career is ultimately what higher education is about, no matter what the age is. And I think that there's no discrimination with age and with gender around, having the qualifiers to get you in the door, to get you to the job that you want to get into and to the passion that you want to pursue.
Excellent. Here's one for you, Adara. In public health, do people also look at mental health issues?
Absolutely. Mental health is a huge area of focus, especially now. I know in my work, we've looked at a variety of legislation that impacts maternal mental health. We've also looked at mental health parity. Mental health is a really important topic, and people can focus on mental health broadly. They can focus on something more narrow, such as autism. So there's so many opportunities within the mental health sphere to really make a big difference. And I'll also say that mental health is one of the areas where there isn't as much public health research out there. And so, there's a lot of room to do really important and interesting work in that world.
Yeah, I'd like to +1 to that. That sounds super exciting. We have somebody talking about the earning potential in this field. We talked a little bit about it with the 10x return on investment. Is there anything else you can add, Adara, around kind of what you saw, at least with kind of people before they get their MPH and then after, in terms of their earning ability?
So at least in the health policy world, you oftentimes need some sort of advanced degree to progress to the next level. So even though I was able to get a job with my bachelor's in science, I really wasn't able to climb the ladder and really do anything more than serve as a research associate or research assistant without a higher level of education. So that in itself can definitely be a limiting factor depending on what area you're interested in. I know from my colleagues, everyone who completed their MPH was able to get really well-paying jobs after, and especially compared to before, I would say on average our earnings have at least doubled.
Wow.
For a lot of my friends who are in consulting, their incomes are quite nice. So, there's lots of opportunities to have a great living wage after you've obtained your MPH.
That's wonderful. That's good news to hear. Obviously, every individual is different, and there's no guarantee that getting a master's in public health would get that type of salary, but it seems like it's more common than not. Sonia has a good question, because you've talked about this a little bit, Adara, is what suggestions do you have for someone with a recent undergrad and no MPH to look for entry-level jobs, particularly in epidemiology? I have found that many entry-level jobs require an MPH.
Yeah, for epidemiology, you're really going to need an MPH to do more work in that. I might look for something a little more general. A lot of universities are hiring research assistants or research associates. Other policy research organizations also are interested in entry-level workers. And so while you may not be doing work that is specific to epidemiology, you really will be gaining valuable skills, and that will make you a really strong candidate when you do decide to apply for an MPH. You could also go straight to your MPH. If you decide that you don't want to work, you can go straight through. A lot of people do that, especially with epidemiology and biostatistics. Personally, I think having work experience is really valuable, and you tend to get more out of an MPH program if you have a little bit to think about and contribute to the program. But I know so many people who went straight through who are doing amazing things post-MPH, so it's definitely not a requirement.
One thing I would add to Sonia's question is that, on Coursera, we do have some courses in epidemiology, and we do have a specialization specifically through Imperial College London. So looking at those courses might be interesting, because they taking them might make you understand, do you really like it? Is it something that you're passionate about? Is it something that you want to pursue? And then also it just gives you a taste of the type of like learning online. Do you like that? The expert instructors that Imperial College London puts on their courses, that gives you a taste of what it's like to actually get the degree. So another question for you, Adara, is that you mentioned project management skills, and that's something that you're doing in your career. Was that something that they taught at all in an MPH program?
No, it wasn't something that I learned in my MPH. Other programs may have project management type courses that you can take, especially if you're doing something more management focused. They may have those types of courses available to you. A lot of it is learning on the job, but also, for example, we talked about, whether you can work and go to school, and I worked full-time, I went to school full-time, and so that in itself is a project management experience. You really have to learn, how to manage your time and how to abide by deadlines that you have no control over. So I really think getting an MPH is just a class in and of itself of project management. And then you can also take other online courses. Diana, I'm not sure if Coursera has project management classes. Yeah. So, that is a great opportunity, and I highly recommend doing some sort of formal learning. Where I work, we're connected to the University of California at Berkeley, and we have a lot of project management training resources available to us. So that's another way I've been able to hone those skills.
That's great. Yeah, so we actually do have a public management or project management course on Coursera, and the person says, do you have advice on which one to take and when is it best to get it? And the one that we have is it's actually a certificate in project management, and it's through University of California, Irvine. So you can find it on the Coursera catalog. It's highly rated. It's a great program. So let me see some other questions. Somebody asked, what's the role of public health in pharmaceutical companies? Do you have any thoughts on that one, Adara?
Not a ton of insight because I haven't worked at a pharmaceutical company. I'm not super familiar with the different opportunities available. I can imagine there's a lot of biology and research expertise required there. And so a lot of those people probably have a master's in science of some sort. There are definitely people at pharmaceutical companies that have master's in public health degrees, and they may be more on the government affairs side or doing some other public health research, at least identifying, areas of interest or things like that. So I'm sorry, I don't really have more insight into that, but I'm sure there are opportunities for people with MPH at pharmaceutical companies.
Yeah, and I think some of them also do things that are more administrative and business. My sister has her MPH, and she works in biotech startups, and then she does a lot of recruiting. So she just, understands what types of skills you're looking for people who are interested in these roles. So I think general management can definitely be part of somebody having an MPH and getting into a pharmaceutical company. Okay, let me see. So somebody's asking, is it possible to study a dual degree of MPH and law without having a basic law degree? And so this person's studying biomedical science and has a background in biostats, epidemiology, EVS, which I don't know what that is, and public health as an elective course. I don't know. Miguel, do you have any thoughts on how somebody who has that question might proceed?
There are many programs that do have the JD MPH option. And so there's different ways to attack this, right? There's one, you can do a on-campus program that does have a formal JD MPH. An example of that would be through the University of California system, Berkeley, UCLA. They have joint agreements between both the School of Public Health and the law school, and that just is embedded into the curriculum, and you add that on and you apply formally through through those programs and become admitted. So those do exist at universities. The cost is one of the things that you want to make sure to monitor, right? The tuition for a JD is price structured differently than the master's program. And so you want to make sure that you look at the professional fees that are associated with those degree programs, if there's going to be support from the school and resources on campus. Now, if you are looking at online programs, you are able to do that, but think about again, cost, time, right? So are these degree programs going to be able to take credit within one another? There might be courses on public health and law or public health and policy that might be articulated over to your JD program in terms of certain electives that you can bring in. So there is a way to plan it and to do it. You just have to figure out whether or not on campus, online, or a hybrid of the two is something that you want to do, like a hybrid of doing an on-campus JD and then an online public health because of cost. So definitely something to explore, and you just want to make sure that you kind of think about like timeline and cost there.
Great answer. Adara, this question specifically for you. What was your undergraduate coursework like, and how did it relate to public health? And was it more social sciences or kind of, politics and policy, or was it more STEM like bio and chem, or was it none of the above?
It was more social services focused. So when I attended San Jose State's program way back a few years ago, it was slightly different from what they offer now, but we did get some of the core public health type classes in that degree. So we took courses in epidemiology and biostatistics. We did a lot of health education focused classes. There really wasn't an emphasis on health policy. They started offering a health policy course after I graduated, but I also focused on health administration. So I took a lot of finance classes and business classes. And, from that coursework, I realized that I wasn't learning exactly what I wanted to learn. And luckily, I had a couple of really amazing professors at San Jose State who encouraged me to pursue my interests and help me craft different types of projects so I could really learn more about policy and, just how it works, because I really wasn't getting that type of education within my program. And then also internships really helped me learn more about the different opportunities and the different ways that people work in health policy.
Great. Somebody asked, is an MD required to be accepted into an MPH program degree? Miguel, you want to take that?
Definitely not. Although you can do a joint MD MPH, but you do not need to have any medical background, or you can even have an undergraduate background in something completely different. And that's when you start to look at the master's program as a way to pivot into public health. A career switcher is what we call that in the admissions landscape. And so to answer your question, no need.
And so just kind of riffing on that question, Miguel, then what is required to get, what undergraduate degree is required to get an MPH?
Yeah, so in general, you want to make sure, so this is going to impact different audiences, but international, you have to make sure if you're going to be learning online in a US degree or in a UK degree, English speaking country, you have to make sure you have your TOEFL or IELTS, right, to have language examination proficiency to show that you are proficient in the English language. There are going to be programs that require the GRE and some programs that don't require the GRE. And so that's also a consideration process in the graduate program space, whether or not you want to get started and learn today, or if you have to take that GRE examination and do that. The other aspect is around GPA, needing to have a cumulative GPA that is competitive, especially for these more tier 1 universities and research 1 universities. You want to have a competitive GPA, as well as the ability to demonstrate academic rigor. You can also show through professional experience whether you are aligned into public health, or there might be projects that you have done with nonprofits, consulting, you might have taken courses already that are aligned to show that you are really interested in the degree. And then with your professional experience, having those letters of recommendation if it is required by the program, to demonstrate, your not only your academic ability but your alignment to public health. And so those are some of the kind of the high level things that you need to think about in the admissions process. And happy to, our team is happy to talk through with you about what those enrollment processes look like for degrees that are hosted on Coursera, and overall what other open degree content and courses that you have accessible to you on the platform.
That's great. So somebody did ask, but does an MD give you preference for an MPH? And I would say, I don't think it gives you preference, but if you have an MD, it's shown that you've done really rigorous work and you're an outstanding academic candidate. So that definitely makes a difference, right?
It does. So I would say that anything that has alignment into the public health space, your professional experience and background, that'll be able to give you a competitive advantage in the admissions landscape is something that you would be able to demonstrate, and like why as a physician or why as a medical administrator you would want to add on the public health degree. I do see, I mean, and Adara, you can correct me, but I do see that now there are more professionals with MD starting to bring in the MPH aspect and that dual degree. That's a lot of research schools started to see that doctors wanted that dual degree with the MPH so that they can have a broader understanding of public health issues, as opposed to just their emphasis and focus in their field.
Yeah, and I would also say a lot of the faculty and researchers I work with through the University of California system, a lot of them are clinicians and researchers. So they may have an MD, MPH, or they may have an MD and a PhD, and they really work in both worlds. They provide clinical care to patients, and then they work, in an office setting and do research and policy analysis.
Great. So we have another question that's like, what are your thoughts, advice on looking for public health jobs right now during the COVID-19 pandemic? Any thoughts on that, Adara?
It's tricky because I'm sure a lot of companies and especially governments are freezing hiring right now just with all of the financial uncertainty. But if you're interested in working specifically on issues related to COVID-19 and the pandemic, I'm sure especially local health departments are really looking for additional help. So I would start there if you're interested in getting involved in COVID-19 specific opportunities.
Great. So we only have 9 more minutes left. So I think what we'll do is let's answer one more question, and then Miguel, I'll have you wrap up. So okay, this is an interesting one from Jessica. How are MPH programs integrating the new use of digital therapeutics? Is that anything you know anything about, Adara?
I don't know anything about how MPH programs are integrating that. I mean, at least as what I can imagine is, at least as far as the core public health courses that everyone who gets an MPH is required to take, I'm not sure there would be a ton of new information included in there. But a lot of public health programs offer really topical classes as electives. And so if that's something you're particularly interested in, I would look at public health programs and see what the faculty members are working on outside of their teaching requirements, because that, they may be teaching specific courses on therapeutics, or you may be able to be involved in some of the research they're working on.
Well, that's great. So why don't we, thanks so much for answering all these questions. There are a lot of questions we didn't get to. Miguel is going to kind of walk through some of the next steps that we have here. And so Miguel, let's look at this slide here.
So there are a lot of different courses and specializations on Coursera from top universities from all around the world, public health leaders like Johns Hopkins University, University of North Carolina, at Chapel Hill, and University of Michigan. So if you are interested in getting your feet wet with public health, do look at our specializations and courses that are related to the public health space. And then right now, as you can imagine, our most popular public health course is the Imperial College of London COVID-19. There are over 66,000 enrollments since it launched in February. And so do look at that if you are interested and want to learn more about what's happening with the global pandemic. And then we do have courses as well on child nutrition and areas around design thinking and public health, and taking a look at that as well. The other thing, if you are ready to take the launch for a degree program, we have 2 online degrees from Imperial College of London, which is our Global Masters of Public Health, and then the Michigan Masters in Public Health. The application for Imperial College of London will close on June 1st, and then the Michigan MPH is open to US students at this time, and it's accepting applications on May 1st. And if you do have questions on that, you can reach out to our enrollment team, and we're happy to support you, and we'll be following up after the webinar as well with other information from our marketing team. So we want to make sure that you have the right information and to think about a degree or courses and specializations on Coursera.
Excellent. So then if you kind of like what you've seen here, there are some next steps, and Miguel, you can walk through kind of all of these next steps that we have here.
So if you are interested in learning more about public health degree options, please do reach out to us at our email inbox, degrees.enrollment@coursera.org. We will then be able to really learn about your interests, learn about what degree program you want to pursue, or maybe some open degree content that you want to try out before committing to doing an application. But please do email us, and we are available to speak to you and schedule a time to talk about your pathway in the public health profession. You're also able to look at our Public Health Hub online. Our Coursera Public Health Hub has all of the different courses and degrees that you may be interested in, and be able to continue to explore the power of the platform from the comfort of your home. So we want to make sure that you have the opportunity to continue to learn online. Another next step as well is to respond to our survey of today's attendees. We are interested to know if you liked today's webinar and the content, and if you would like to see more in the future, and how we can better support you all in this journey. And we really thank you for being a part of the conversation today during this time.
Yeah, so this wraps up our webinar, and we have recorded it. We will be sending out the recording to everyone. We'll be sending out a way that people can schedule a call to everyone. We'll also be sending out a link to the slides, so that I know a number of people have asked us for that. This was an amazing group of people who came. It looked like we probably had over 300 people who joined us today from all around the world. It's a huge testament to the power of Coursera's platform, that we have people from literally everywhere in the world coming on today. And I imagine it's either very late in the evening or very early in the morning for many of you. So I want to thank you all. And a big shout out to Adara for being our expert today. So Adara, thank you so much for joining us. And to Miguel, because we just love that both of you guys have such deep expertise in the area that you understand. So thank you so much. And everyone be safe, and yeah, stay inside.
Thanks, Adara. We appreciate it. Thank you all for watching.
Thank you for having me.
Of course. Okay. Bye-bye, everybody.